Every single shift I work in the emergency department, without exception, I see people with stomach pain and bowel symptoms. Every single shift. It accounts for roughly a quarter of everything that comes through those doors. And what strikes me every time, what has struck me consistently across 13 years in emergency medicine, is how many of those people arrive carrying the same quiet, unspoken fear. They're not just worried about the pain, they're worried about what the pain might mean. They have been Googling their symptoms at midnight. They have read things that frighten them. And they have spent weeks, sometimes months, wondering whether what they are experiencing is something they should be urgently worried about, or whether it is something that can be explained, managed, and lived with. My name is Dr. Miles, 13 years in emergency medicine. And the conversation I want to have with you today is the one that most of those people needed long before they ended up sitting in front of me. Because the confusion between IBS and bowel cancer is one of the most common, most understandable, and most important things to get clear on. The symptoms overlap. The fear is real. And the difference between the two, once you understand what doctors are actually looking for, is more navigable than most people realize. So by the end of this video, you are going to have a clear clinical framework. You are going to know what IBS actually is, how bowel cancer tends to present differently, what the specific red flags are that doctors are trained to act on, and this is important, the psychological trap that people with IBS fall into that can cause them to miss something serious. That trap has caught people out badly. I will come to it later in the video. But before anything else, if this is the kind of clear, honest, evidence-based content you want more of, please subscribe to this channel right now. No agenda, nothing to sell. Just the information you deserve to have. It means everything when you join this community. Now, let us get into it. Before we go anywhere else, I want to say something clearly, because I think it matters enormously for how you receive everything that follows. Most people with bowel symptoms do not have cancer. The vast majority of people who come to me with gut pain, bloating, changes in their stool, urgency, discomfort, the vast majority have a completely benign explanation. IBS, dietary intolerance, a gut infection, stress, anxiety. All of these are extraordinarily common. All of them can produce symptoms that feel alarming when you are living inside them. Bowel cancer is also common. I am not going to pretend otherwise. But the pattern of bowel cancer is genuinely different from the pattern of IBS. And pattern is exactly what doctors are trained to look for. Not drama, not worst case scenarios, pattern. By the time this video is finished, you will be able to read that pattern too. What IBS actually is. Irritable bowel syndrome is what we call a functional bowel disorder. And that word functional is important. It means there is no structural damage, nothing physically wrong with the bowel itself. If you took someone with severe IBS and looked inside their bowel with a camera, a colonoscopy, it would appear completely normal. The bowel is intact. It is simply not functioning the way it should. It is dysregulated, overreactive, unpredictable. IBS is not inflammation. It is not cancer. It is not damaged. It is a bowel that has lost its regulatory rhythm. The diagnosis is not made through a scan or a blood test. It is made based on the pattern of symptoms, what we call a clinical diagnosis. Your doctor listens to what you describe and recognizes a pattern. That pattern typically looks like this. Recurrent abdominal pain. Pain that keeps coming back. Often crampy, often in the lower abdomen. And this is the key feature pain that is connected to going to the toilet. Either it comes on when you need to go, or it is relieved when you do go. Sometimes both. Changes in stool frequency or consistency are also common. Going more often or less often. Looser stools or periods of constipation, sometimes alternating between both. Bloating, that uncomfortable fullness and distension that tends to build up through the day and ease overnight. And mucus in the stool, which sounds alarming, but is actually far more commonly associated with IBS than with anything sinister. If mucus is the only symptom you have, that is generally quite reassuring. Crucially, IBS is a chronic condition. This is not something that appeared 3 weeks ago. IBS has typically been present for months or years. It fluctuates. Better days, worse days, good weeks, bad weeks. Stress makes it worse. Certain foods make it worse. Onions, garlic, beans, wheat are common triggers, though this varies significantly between individuals. Anxiety can make it significantly worse. and it very commonly begins under the age of 50, often in younger adults, sometimes as early as the late teens or early 20s. One more thing I want to say here, and this is my own clinical opinion, rather than established consensus. Part of the reason IBS rates are rising, particularly in younger people, is ultra-processed food. The emulsifiers, preservatives, stabilizers, and synthetic compounds packed into ultra-processed foods are substances the human gut has never encountered in its evolutionary history. The microbiome does not know what to do with them. The bowel lining is disrupted by them. The way the bowel moves and signals is thrown off by them. I think in a few decades, we will look back at this era and recognize the specific damage ultra-processed food did to gut health. If you have IBS, or suspect you might, looking honestly at how much ultra-processed food is in your diet is one of the most productive places to start. How bowel cancer tends to present differently. Now let us talk about bowel cancer, and specifically how the pattern differs, because this is the crux of everything. The two conditions share some symptoms on the surface. Both can involve abdominal pain. Both can involve changes in bowel habits. But the character of those symptoms is fundamentally different. And that character is what separates a pattern that needs urgent investigation from one that can be managed. The single most important word when thinking about bowel cancer is progressive. IBS fluctuates. Good days, bad days. Symptoms that come and go, that respond to stress, that ease with certain foods avoided, that improve and then worsen again. Bowel cancer does not behave that way. Bowel cancer tends to produce symptoms that persist and progress. They do not really have good days. They do not really go away and come back. They accumulate. They get worse. Week on week, the direction of travel is downward. That distinction alone, fluctuating versus progressive, is one of the most clinically useful tools a doctor has. And now you have it too. The red flags know these. These are the specific warning signs that doctors are trained to act on urgently. These are not subtle. These are the combinations that should prompt you to book a GP appointment without delay. Number 1. Rectal bleeding. Blood from the back passage, particularly in anyone over the age of 50, is a red flag. It needs to be assessed, not monitored at home. Assessed. Number 2. A change in bowel habit lasting more than 3 weeks, particularly if that change is towards looser stools or going more frequently. A new pattern that has simply not gone away. Number 3. Unexplained weight loss. Losing weight without trying to. Without a clear reason. Your belt is sitting looser than it used to. Your clothes feel different. You have not changed your diet or your exercise. This needs to be investigated. Number 4. Iron deficiency anemia. Often picked up on a routine blood test, it can cause fatigue, breathlessness, and pallor. And it can be caused by slow, chronic bleeding from a bowel tumor that you might not even be aware of yet, because the bleeding is happening internally rather than visibly. Number 5. Persistent abdominal pain combined with weight loss. This combination in particular needs urgent attention. Number 6. Significant family history. A first-degree relative, a parent or sibling who has had bowel cancer. This substantially increases your personal risk and should be discussed with your GP, so your surveillance schedule can be adjusted accordingly. And then there is one more red flag that I want to emphasize specifically, because it is one of the most practically useful distinguishing features between IBS and bowel cancer. Symptoms that wake you from sleep. IBS does not generally wake people up at night. If you are being woken by abdominal pain, by an urgent need to use the toilet in the early hours, or if you are waking drenched in sweat, you need to see a doctor promptly. This is not something to monitor. This is something to act on. IBS versus bowel cancer side by side. Let me lay this out as clearly as possible, because I think this comparison is the most practically useful thing I can give you. With IBS, symptoms come and go. They fluctuate. They have often been present for months or years. The pain is typically linked to going to the toilet, and often improves afterwards. There is no unexplained weight loss. There is no blood in the stool. There is no anemia. Symptoms are commonly triggered by stress or specific foods. It typically begins in people under the age of 50, often significantly younger. With bowel cancer, the change tends to be relatively new, something that was not there before, or a noticeable shift from what was previously normal for that person. Symptoms persist and progress. They do not really go away. They tend to get worse over time. There may be blood mixed in with the stool, or visible on the paper. There may be unexplained weight loss. There may be fatigue from anemia. And symptoms may disturb sleep, which IBS essentially never does. That is the pattern. That is what doctors are reading. And now you are reading it too. Why age matters. Age is one of the most important factors in this entire conversation. The risk of bowel cancer rises significantly with age. The clinical threshold used by NICE, the National Institute for Health and Care Excellence, is 50. If you are under 40 with long-standing symptoms that fluctuate, that are clearly connected to food or stress, with no blood, no weight loss, no anemia, and a pattern that has been consistent for months or years, that clinical picture is far more consistent with IBS than with anything sinister. That does not mean you should not see a GP. It absolutely does not mean that. But the probability strongly favors a functional cause. If you are over 50 and you have a new change in your bowel habit that has persisted for several weeks, or there is bleeding, or there is weight loss, that needs to be investigated now, not next month, now. And I want to be fair about something. Young people can get bowel cancer. Rates in younger adults have risen in recent years. It is not impossible. It is not unheard of. But the probability remains significantly lower, and the pattern of symptoms matters even more in that context. Red flags are red flags, regardless of age. Blood in the stool is always worth investigating. Unexplained weight loss is always worth investigating. If you have any of those red flags at any age, you need to see your doctor. If you are between 50 and 74 in the UK, the NHS will automatically send you a home fit test as part of the National Bowel Cancer Screening Program. It comes through your letterbox. Use it. It is free. It exists precisely because catching bowel cancer early makes an enormous difference to outcomes. If you are in that age range and you have never received one, call your GP, confirm your correct address, and find out what has happened. The psychological trap. Now, the trap I mentioned at the very beginning of this video. If you have had IBS for years, and millions of people have, there is a very natural, very understandable tendency to attribute every new bowel symptom to your IBS. Something changes, and your first thought is, it is just my IBS again. For years, every gut symptom has been your IBS. Of course, that is your first instinct. It is rational, but this is the trap, and it has caught people out badly. If you have IBS and something feels genuinely different from your normal pattern, not just your usual bad day, not just a familiar flare, but something that does not fit your usual IBS picture, a new symptom, a different character, something your gut is doing that it has not done before, that is the moment to seek a medical review rather than assume. Call your GP and say, I have IBS, but I have some new symptoms I want to discuss. That is all it takes. Your baseline matters enormously in medicine. You know your gut better than anyone. If your gut is behaving differently from how it normally does, even compared to your worst IBS days, that difference is worth talking about with a doctor. Do not let years of IBS diagnoses become a reason to dismiss something that deserves attention. Bringing it all together. Most bowel symptoms are not cancer. The pattern of IBS fluctuating, chronic, linked to stress and food, absent of red flags, is reassuringly different from the pattern of bowel cancer in the vast majority of cases. But specific combinations matter. Progressive symptoms matter. Blood matters. Weight loss matters. Night symptoms matter. Age matters. Family history matters. And if you have IBS, a change from your normal pattern matters. What I want you to take from this video is not anxiety. It is clear. Know the red flags. Know your own pattern. And if something changes in a way that worries you or fits what I have described today, book a doctor's appointment. That is what we are here for. And remember this, knowing is always better than wondering. The reassurance that comes from being checked and cleared is worth infinitely more than weeks of quiet worry that leads nowhere. Persistent change should never be ignored. But the vast majority of the time, when you do get checked, you will be reassured. If this video gave you something useful, and I hope it genuinely did, please hit the like button and subscribe to this channel. Every week, I break down the medical conversations that people need to have, but rarely get the time or space to have properly. Share this with someone who has been worrying about their gut symptoms and does not know where to start. That share could genuinely matter. I will see you in the next one.